To me, antimicrobial stewardship is being sure to use antibiotics or antimicrobial agents judiciously and appropriately, keeping in mind kind of evidence-based duration of treatment so that we're not over-treating or under-treating with antibiotics, and then also looking at local resistance patterns with different antibiotics to target and use antibiotics that are known to be effective in the area without high resistance.
Simply, it would be deciding who needs antibiotics for their complaint. And when you decide someone needs antibiotics, selecting the appropriate antibiotic for that situation. You want to try to get it as focused as possible toward that infection. So making sure that the right people get antibiotics and then the right antibiotics are chosen.
The conservation of antimicrobials, so the appropriate and judicial use of them, so that they can maintain their efficacy in roles of it as far as everyday usage.
Antimicrobial stewardship, particularly in pediatrics, is very important. It means that the future of my patients, when they're older and when they have kids, that I hopefully will get to take care of as well, that we have antibiotics around that will treat the same infections. If we don't appreciate antibiotic stewardship now, then we will not be able to utilize the same antibiotics that we currently use to treat very common everyday infections, which could precipitate worse outcomes, especially in very young patients.
I think we have to be really careful not to go overboard with our antibiotic usage too quickly, because I've definitely seen that a lot in the past. I think we as a profession are getting better about being more careful, reaching for first-line antibiotics for things that are routine, which is most of what we see in primary care. So we are not reaching for those kind of bigwig antibiotics as often as like some of the specialists may have to.
Antimicrobial stewardship, what it means to me is it has really changed over the years. I think it's a topic that was minimally discussed, a number of years ago, and now it's really come to the forefront of awareness. Antimicrobial stewardship, the importance of it, is really looking at as a societal responsibility. I think we as the physicians, we're very responsible for the use of the antibiotics, and we're learning the impact that they have on so many other areas.